I'm Allison Crosby, and this is my head-to-toe assessment. Today I have with me Alexi. She's a 17-year-old white female, no medical history, no known allergies, food or drug. She does not take any medicines, and she has no prior surgical history. Is that correct?
Yes.
Her vital signs are 97.8, 122/68, 100% on room air. Heart rate was 71. Respirations were 16. She's 64 inches and she weighs 130 pounds. She has no complaint today. She's here for the head-to-toe assessment, and I've already explained most of it to her, and I told her that I would be talking to her as we go along and she would be answering questions. I'm going to wash my hands and we're going to get started, okay? Okay, Alexi, the first thing I'm going to need you to do is I'm going to put your head down for a second. Have you get up on that side of the bed. I'm going to have you walk around the room so I can assess your gait. Just walk normally for me. Okay. Ambulation is normal, no ataxia or listing noted. I'm going to have you turn towards the door there and bend over like you're going to touch your toes. Just going to check your back for scoliosis. Round your back out for me. Okay, no curvature of the spine noted. You can have a seat for me. Go ahead and lay that down. Let you get back up there. Lexi, I'm going to test your alertness or your level of consciousness. Can you tell me your name?
Lexi,
Can you tell me where you are?
Trinity Hospital,
Very good. Do you know what day it is?
Saturday,
Okay. Do you know the date?
April 25th.
Very good. Do you know who the president is?
Barack Obama.
All right. Do you know what we're doing here today?
Head-to-toe assessment.
Very good. So Alexi is alert and oriented times 4. First thing I'm going to do is look at your head and face, okay? Lexi's head is normocephalic. Her facial features are symmetric. No abnormalities, swelling noted. Her scalp is normal. No swelling or abnormalities noted. Her scalp is mobile. No nits or bugs noted. Her scalp is pink. Her skin on her face is pink. Normal for race. No lesions or rashes noted to her face. We'll feel your temporal arteries. They are present and strong. 2+. Listen for to your temporal arteries, and we're looking for what they call a groovy or a swishing sound. No bruise noted. Right, let's say we'll push on your sinuses. You tell me if you feel any pain or tenderness. Okay. Any pain or tenderness when I push right there? How about here? No pain or tenderness noticed upon palpation of the frontal or sinus maxillary sinuses. I'll feel your jaw right here. Open for me. Close. Open again. Close. Any pain or tenderness when I do that? TMJ movement is normal, symmetric, no pain or tenderness noted. I also I'm going to test Lexi's trigeminal nerve, excuse me, which is cranial nerve 5. You can clench your jaw for me. Okay. Clenching noted. Trigeminal nerve or cranial nerve 5 is intact. Okay, Lexi, I'm going to continue to test some of your cranial nerves. I want to test your facial nerve and your trigeminal nerve, which are cranial nerves 5 and 7. If you would just copy me. Raise your brows for me. Furrow them. Puff your cheeks out. Bare your teeth. Smile. Very good. All movements are symmetric, so her trigeminal and her facial nerve, cranial nerves 5 and 7 are intact. All right, I want to touch your face. on certain areas of your face. I'm going to have you close your eyes and you just tell me where I'm touching you, okay? As soon as you feel me touch you, just let me know where I'm touching you.
The side of my eye.
Very good.
Below my eye.
Corner of your
My
nose.
nose. Cheek. The side of my lip.
There you go.
Other side of my lip. Below my nose. The side of my eye.
Very good. All sensations are equal on both sides. Okay, Lexi, the next thing we're going to do is test your vision. I have a chart out in the hallway. I want you to cover your left eye and read the smallest print that you can read.
D-E-F-E-O-T-E-C.
Good job. Lexi's vision in her right eye, or OD, is 20/20. Cover your right eye for me now and read the smallest line.
D-E-F-T-O-T-E-C.
Good job. Lexi's vision in her left eye is 20/20. OS would be 20/20. Now, both eyes uncovered. Smallest line you can read.
L-E-F-O-D-P-O-T.
Good job. So Lexi's vision in both eyes, or OU, would be 20/15. Great job. Thank you, Lexi. All right, Lexi. Now I'm going to continue to test some of your cranial nerves. Alright, we're going to test your oculomotor nerve, or your cranial nerve 3. I'm going to have you close your eyelids for me, and I'm just going to look at them. Okay, they close symmetrically with no tremors. I'm going to palpate. Close them again for me. Any tenderness? Very good. Okay. No tenderness or pain, no lesions noted. We'll look at your conjunctiva. Okay. We'll pull your lids down. Conjunctiva is pink and normal. No redness or swelling. Same for the upper lids. Our sclera is white and free of exudate. Okay. Now I'm going to push on the sides of your nose here. Any pain when I do that?
No.
Okay. Any pain on this side? Okay. Lacrimal ducts are non-tender, painless, no exudate or excessive tearing noted. I'm going to turn the lights off for just a second. Or down. Okay, I'm just going to look at your eyes real quick. Just look at my nose. Okay. Her sclera and cornea and lens, her cornea and lens are free of opacities. Just look at my nose again. Okay. And her alignment of her eyes is normal. The light reflected on her cornea is at the same spot. That checks her cranial nerves 3, 4, and 5, 6. Her ocular, her trochlear, and her abducens nerves. So all three of those are intact. Okay, look at my nose again. Pupils are reactive to light. Look at my nose. Look at the wall behind you. No, I'm sorry. Look at my finger. Look at the wall behind you. Now look at my finger again. Pupils are equal reactive to light and accommodation. Okay. Now I'm going to do another test. I'm going to have you turn to the side and swing your legs over here. Sit on one side of the bed. I'm going to have you follow my pen, okay, with both eyes. Good. I just tested Lexi's oculomotor nerve, cranial nerve 3 in the 6 cardinal positions. I did not have any tremors or nystagmus noted. Her movements were smooth and equal. All right, Lexi, we're going to look at your ears. Lexi's ears are symmetric, no lesions, rashes, swellings noted to the ears. I'm going to press on your mastoid process. You tell me if you feel any pain. Any pain right there when I do that? No swelling or pain noted at her mastoid process. I'll look at your ears. Okay. Auricle and ear canal are free of exudate on this side. Auricle and ear canal are free of exudate on this side also. Alright, Alexi, now I'm going to test your hearing or your acoustic nerve, which is cranial nerve 8. I'm going to occlude one ear and I'm going to whisper a word in your other ear. I want you to tell me what that word is out loud, okay?
Baseball.
Very good. I did in fact say baseball. Now we're going to do it to this side.
Dancing.
Very good. I in fact did say dancing. So that tells me that Alexi's acoustic nerve or cranial nerve 8 is intact. Unfortunately, we cannot do a bone or air conduction test at this time because this hospital does not have a tuning fork. Okay, Alexi, now I'm going to assess your nose and throat. I'm just looking at your nose and throat. Your nose is symmetric. It is midline on your face. No deformities, lesions, or swelling noted. I'm going to test your nostrils. Okay, let me get my glove real quick. Just breathe deep in, blow out. Okay, same on that side. Good. Air moves freely through both nostrils. Now I'm going to test your olfactory nerve or your cranial nerve 1. I'm going to hold a smell or item that you can smell under each nostril, and I want you to try to identify it for me, okay? I'm going to have you close your eyes. Occlude one of your nares like I just did. And just take a sniff. Tell me what you smell. Coffee. Very good. That is in fact coffee. I'm going to do it to the other side. And tell me what you smell. Sniff.
Hand sanitizer.
Okay, very good. It's alcohol. Very good. So that tells me that Alexi's olfactory nerve or cranial nerve 1 is intact. All right, now I'm going to just assess your nose. Let me get my whisper. Okay, tilt your head back for me. Alright, mucosa is pink, moist, no lesions noted, no swelling noted. Her septum is midline, and no deviation was noted on her nose. Okay, Alexi, now I'm going to assess your mouth. First thing I'm going to look at is your lips. Your lips are pink, normal, no lesions or rashes noted, no swelling, no cracks, no scaliness noted to her lips. I'm going to look at your oral mucosa, or the inside of your mouth. Open up for me. Okay. Oral mucosa is pink, free of lesions, no nodules noted. Get my tongue depressor out. Okay, I'm just going to check on the inside of your cheeks here. Lexi's teeth are clean. No decay noted. No odor to her breath. Her hard palate is white and pink. No lesions or rashes or nodules noted. Her soft palate is pink and smooth. Uvula, open up again, is midline. Her tonsil, she does have tonsils and they're graded at a +1. Her tongue is symmetric, open again, smooth, little rough, midline. No deviations or tremors noted. The next thing I'm going to need you to do, I'm going to check your hypoglossal nerve. And what I'm going to do is I'm going to press against the side of your tongue with this tongue blade, and then I want you to push against it, okay? So stick your tongue out for me. Press against. Good. Other side. Press against. Very good. The resistance is equal on both sides, and that tested Lexi's hypoglossal nerve or cranial nerve 7, and that is intact. Okay? Excuse me for a moment while I get some gauze. Alright, I'm just going to check the floor of your mouth for any swellings or nodules. Checking for the floor. That's what we're checking for, okay? Okay, just stick your tongue out for me. Okay. No swelling or nodules noted when I'm palpating the floor of Lexi's mouth. Sorry. Alright, Lexi, the next thing I want to do is test your glossopharyngeal and your vagus nerves, which are cranial nerves 9 and 11, and 10. I want to have you stick out your tongue. Oops. Say ah. Very good. Lexi's soft palate did rise symmetrically. Her uvula stayed midline. Her pharynx is pink and smooth. And like I said earlier, her tonsils are graded at a +1. The next thing I'm going to do, you're not going to like me, and I apologize, but I'm going to have to test your gag reflex, okay? Stick your tongue out. That lets me know that her her glossopharyngeal and her vagus nerves are intact, which are cranial nerves 9 and 10. All right, Alexa, the next thing I'm going to assess is your neck. I'm going to look at the muscles in your neck. Her muscles in her neck are symmetric. Turn your head for me. Turn this back this way. Good. No swellings, lumps noted. Movement of the neck is smooth and even. I'm going to test your range of motion of your neck. I just want you to listen and follow me, okay? Chin to your chest. Right back up. Head back. Good. Here to the shoulder. Other side. Chin to the shoulder. Other side. Good. Lexi's, any pain or tenderness with that? Good. Lexi's movements were smooth, painless, and symmetric. Okay. I want to test your spinal accessory nerve or your cranial nerve 11. I'm going to press down on your shoulders here. Shrug your shoulders for me. Good. She was able to overcome that resistance. Now I'm going to have you turn your head against my hand. Very good. And again. Very good. She was able to overcome that resistance too. Her movements were smooth, symmetric. Any pain or tenderness when I did either one of those? Great. Okay, Lexi. The next thing I'm going to test on you or check is your lymph nodes. I'm going to have you swing your legs back on the side of the bed. Okay. Any pain or tenderness when I touch any of these, let me know, okay? Alright, I'm going to assess Lexi's lymph nodes. I'm going to do pre-auricle. Any pain there? Okay. Post-auricle. Any pain? Okay. Submandibular. Any pain? Or submental, I'm sorry. Now submandibular. Any pain? Okay. Great. Occipital. Any pain? Or tonsillar. Any pain? Good. Or superficial cervical. Any pain?
No.
Her deep cervical chain. Any pain? Any pain right there on her supraclavicular? Nope. And in her post-cervical. Any pain? Good job. So Lexi has no tenderness or pain noted on palpation of her lymph nodes and no lymphadenopathy noted. I'm going to lay your head just a little bit. Look at your jugular veins here in your neck. I'm going to have you look away from me. Look to that side. No jugular vein distension noted on this side. Come back this way. No jugular vein distension noted on this side. Pulsations are noted on this side. And pulsations are noted on this side. All right, we'll have you sit back up. Okay. We'll check out your trachea here. Trachea is midline. Okay. Now I'm going to test your thyroid. I'm actually going to have you swing your leg to the other side of the bed. Swallow for me. Good. Lexi's thyroid is smooth. Get you a cup of water real quick. swallow again with the water. Good job. No enlargement noted on Alexi's thyroid. I'm going to listen to your thyroid. Or any bruise, just like I did earlier on your temporal arteries. No bruise noted. Alright. You can swing back to the bed here. Okay. Now I'm going to assess your carotid artery. Beautiful. Pulse is present, rated at a +2. Again, pulse is present, rated at a +2. Again, I'm going to listen to you, okay? Take a deep breath and hold it. You let it out. Again, take a deep breath. Hold it. You let it out. Good. No bruise noted in the carotid arteries. Okay, Alexi. Now I'm going to assess your chest and your lungs. I'll put you down just a little bit. Have you swing your legs on that side of the bed. All right. Just looking at your chest. Okay. No abnormalities noted in her chest. Lexi's respirations are regular, symmetric. No retractions noted. Her anterior, posterior, and lateral chest are normal. No barrel chested noted. All right, Lexi, I'm just going to palpate your spine here again. Any tenderness anywhere? No pain. Okay. Lexi's spine evenly spaced, no pain or tenderness noted. Okay, Lexi, I'm going to put my hands on the bottom of your rib cage. Okay. Breathe in. Again. Good. Just testing Alexi's respiratory expansion, and it is symmetric to both sides. All right, Lexi, I'm going to do what they call tactile rheumatism. I'm going to put my hands on your back and have you say the word 99. Okay, so every time you hear me, feel me touch your back, just want you to say the words 99, okay?
99, 99, 99, 99, 99, 99, 99.
Okay. Vibrations were equal on both sides of the tactile rheumatism. Okay, now I'm going to percuss your lungs. No hyperresonance noted during percussion, no dullness noted in the lung fields. Alright, I'm going to check your kidneys here. Any tenderness when I do that? Any tenderness on that side? Good. So without tenderness or pain on CVA percussion, that would mean that Lexi does not have pyelonephritis or any kidney problems. I'm going to listen to your lungs, okay? Deep breath in. There we go. Again. posterior lungs are clear to auscultation. No crackles, wheezes, or rhonchi noted. Hey, Alexi, I'm going to do the same thing to the front of your chest. No more have you swing your legs towards me. Didn't know you were going to get all this exercise, did you? Okay. Alright. Feeling your chest for any lumps. No tenderness or pain when I do that. No swelling or nodules noticed. No pain. Noted. No pain or tenderness noted also. Alright, same thing. I did earlier. Breathe in. Good job. And again. Good. Okay. Respiratory expansion is symmetric and equal on both sides. Now, we're going to do the tactile front again with the 99. So every time you feel me touch you, or every time I move my hands, say 99.
99. 99. 99. 99. 99. 99. 99.
Good job. So tactile fremitus vibrations were equal with the tactile fremitus. Excuse me. Now I'm going to do the percussion, okay? Resonance is equal, no hyperresonance noted, no dullness noted. Listen to your front side now, okay? Breath in out. Okay. Yeah. Okay. Good job. Alright, no adventitious lung sounds heard. Clear to auscultation, no crackles, wheezes, or rhonchi noted. Heard vesicular sounds over the lungs, tracheal sounds over her trachea, and bronchosvesicular sounds up in the upper chest. Alright, Lexi, I'm going to assess your heart now. Here, Lexi, now I'm going to assess your heart. First thing I'm going to do is feel for your apical pulse, which should be between your fourth and fifth intercostal space. Okay. Pulse is good. Now I'm going to listen to your heart. Going to listen to your aortic valve. The second intercostal space, right sternal border. Now your pulmonic, second intercostal space, left sternal border. Erb's point, third intercostal space, left sternal border. Fourth intercostal space, tricuspid, left sternal border. And your mitral. Fifth intercostal space, left mid-clavicular line. This is where S1 is best heard. Rate about 70. Rhythm is normal. No gallops, clicks, rubs, or murmurs noted. S2 is best heard at the second intercostal space. No S3 or S4 noted, so no murmurs. S3 is usually found in children, young adults, pregnant women in their third trimester. It is heard after S2 and is called a ventricular gallop. She did not have an S4 either, which are also heard in children, well-conditioned athletes, and healthy elderly adults with no cardiac history, or patients with MI or heart failure. It is heard before S1 and is called an atrial gallop. Lexi, next thing I want to ask you about is breast exams. Do you do monthly breast exams?
No.
Do you know how to do them?
No.
Okay. I'm just going to go over it with you real quick. Once a month around your period, you're going to want to check your breasts for lumps, swellings, or anything abnormal. Okay. What you need to do is you're going to raise your arm over your head, and then you're going to either go in a circular motion, starting from the outside, going towards the areola, or you're going to go in a zigzag pattern. Okay. And you're also going to want to get up into your axillary area because you do have breast tissue up under there. So both breasts once a month. Okay. So start doing that. Okay, Lexi, I'm going to assess your arms now. I'm going to check your range of motion. So if you would follow me, arms out, arms up, arms right, arms down. I don't know how well you can circle your arm in that bend. Good job. And the other way. Good. Lexi's range of motion is normal. Her muscle mass, she's got some muscles, so she's fairly toned. Her skin is warm, dry. Color is normal for race. Capillary refill is less than 2 seconds. Her fingernails are clean, manicured. No clubbing or spooning noted. Palpate your pulses in your arms. Pulses are present, +2. Pulses are equal on both sides, graded at a +2. Now I want to check for neurosensory loss. I'm going to place an item in your hand with your eyes closed, and I want you to tell me what that item is, okay? Okay. Close your eyes for me. See this hand? Can you tell me what that item is?
A key.
Very good. And it is, in fact, a key. Keeping your eyes closed. That hand?
A quarter.
Very good. You even knew what kind it was. It is, in fact, a quarter. All right. The next thing I'm going to check, keeping your eyes closed, I'm going to draw a number in your hand. I want you to tell me what number I draw, okay?
3.
Very good.
3.
Very good. You can open your eyes. I didn't actually draw on your hand. All right, the next thing I want to check is your cerebellar and motor function. I want you to do what's called rapid alternate movements. And what that consists of is taking your hands back and forth like this, and then doing it fast. Okay, go ahead. Good job. All right, that lets me know that her cerebellar and motor functions are intact. All right, now what I want you to do is with your index finger, I want you to point to my finger, touch my finger, and then touch your nose. And do it again. 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 All right, other hand. Your nose. Good job. All right, the next thing I'm going to do is have you touch your finger to your nose with your eyes closed. Arms out though. Oh, now touch it. Touch it. Good job. Other one. Good job. That lets me know that her cerebellar and motor functions are intact. Next thing I want to check, I'm going to have you put this heel on this shin. Drag it down. Good job. This heel, same thing. Good job. That lets me know that that is intact. Next thing we're going to do is test you for carpal tunnel syndrome. Carpal tunnel syndrome is where this nerve gets compressed and then you get numbness and tingling in your hands. So we're going to do that test. First one I'm going to do is the Tennell's sign. Let me know if you have any tenderness or pain when I do this. Okay. Okay. So let's lets me know that that sign is negative. The next one we're going to do is called the Phelan's sign, and what I want you to do is I want you to hold the backs of your hands together and kind of press your wrist or elbows down, and hold that for about 60 seconds. Let me know if you have any tingling or numbness in any of your fingers. Okay. Generally, you would have the patient hold that for 60 seconds. If they had any tingling or numbness, then that would be a positive sign. Lexi does not have any tingling or numbness at this point in time, even though we only did it for about 20 seconds. So her sign would be negative. We're just take it down, so I don't have to look at your abdomen. I'm gonna lay you all the way flat, okay? All right, Lexi, I'm going to assess your abdomen now. That's why I have you laying flat. Okay, I'm just going to look for the moment. Okay, no bulges noted. Lexi's umbilicus is midline and inverted. It is pierced. Has some kind of metal object in it. All right, I'm going to listen to your stomach. Okay. Bowel sounds were present in all 4 quadrants. Are you hungry? They're kind of loud. And I did not hear any bruits in the femoral, renal, or aortic areas. All right, Lexi, I'm going to percuss your stomach here. All right. Tiffany was heard in most of the abdomen. All right. I'll check for your liver stand here. Lexi's liver span is right over 5 centimeters, so that is normal. Now, Lexi, I'm going to palpate your abdomen. I'm going to do it lightly and then deeply, and then I want you to tell me if you have any pain, okay? Any pain anywhere? Okay. Tickles?
Yeah.
Sorry. Any pain?
No.
All right. Now I'm going to palpate your liver. We didn't feel any swellings or masses noted with the palpation. So now I'm going to palpate your liver. Okay. You're pressing against me. Let's tickle. feel like his liver right there. Okay. We're gonna go to the other side and try to palpate your spleen. And I cannot palpate her spleen. Not to see I'm tickling her. No swellings or masses noted with any of the palpation. Alright, let's see. Next thing we're going to look at is your legs. The first thing we'll do is check your temperature, the warmth, and all that good stuff. Lexi's legs are warm. There's no hair on her legs, so I can't assess her hair growth. Legs are symmetric. Muscles are toned. I'm going to have you swing over and step off a bit. Push down first. Lexi's skin color on her legs is normal for her race. No lesions or rashes noted. We're going to do some range of motions exercises. I want you to just copy me, okay? Legs up. Hips on up. Ooh! Hips pop. Out to the side. Okay. Out to the side. Okay. Good job. Okay. You have a seat. Lexi's range of motion is normal, symmetric, and smooth. Alright, we're going to assess your pulses in your leg. Alright. Popliteal pulses are equal symmetrically, rated at a +2. Posterior tibialis, rated at a +2. And her dorsal pedis rated at a +2. Toenails are clean, halfway painted. No clubbing or spooning noted. No yellowing or thickening noted. Alright, Alexia, I'm going to check your reflexes now. We're going to start with your bicep reflex. That lets me know that Lexi's bicep reflexes are intact. Alright, we're going to test your tricep reflex now, okay? Okay. Show my elbow on my hand. Okay. Very good. Watch your elbow in my hand. Alright, now I'm going to do your brachioradial reflex. Okay, good job. The bicep, tricep, and brachioradial reflexes are normal. Okay, Lexi, now I'm going to test your patellar, which is your knee, and your Achilles, which is your heel, ankle reflexes. If I can have you swing the legs on that side of the bed for me. Just let your legs fall naturally. Good job. It lets me know that Lexi's patellar reflex is normal. Alright, Lexi, I'm going to test your Achilles reflex here. Okay. Lexi's Achilles reflex are intact. Alright, yeah, I'll let you lay back on the bed here. I'm going to check your Babinski reflex. I'll take socks off. Okay, no fanning of the toes were noted, so that Babinski reflex is negative. Excellent. Again, no fanning of the toes, so her Babinski reflex on that foot was negative also. Alright. Okay, Lexi, I'm going to do a Romberg test on you. What I'm going to need you to do is stand up for me. Okay. I'll need you, go ahead and face the camera. I'll need you to close your eyes. I'm just going to watch and see if you sway. Put your arms out in front of you. Okay, you can put your arms down. Nothing else. No swaying noted. Last thing we're going to do, Lexi, is we're going to do what's called a tandem walk. I'm going to have you start close to the wall over there. Then I'm going to need you to walk heel to toe in a straight line. Good job. Alright, you can come sit back down. All those tests were negative. Romberg and the tandem walk were negative. Lexi did those with no problems, no swaying noted, and no ataxia or listing noted with her gait in the tandem walk. Alexi, we're finished. Thank you very much. Thank you.